Hey, did you know your liver is basically your body's engine room? It powers your energy, keeps your blood clean, and controls your metabolism. Today, we're talking about a new way to help your liver heal and perform better using gentle ultrasound. We'll go over how it can help your liver regenerate, fight off scar tissue, improve your metabolism, and even make you feel more energized. You'll also learn the exact spots to target, how often to do it, and why this could be a game changer for your overall health. So, why would you want to stimulate your liver in the first place? When your liver is inflamed or stressed, everything from your energy to your digestion takes a hit. Low-intensity ultrasound can calm down inflammation, reduce early signs of scarring, boost how your body handles sugar, and help balance your cholesterol and liver enzymes. People in early studies saw better energy, clearer thinking, less bloating, and healthier blood markers after consistent use. If you want the best results, placement is everything. You've got two main targets. First is the porta hepatis. That's the gateway to your liver. It's about 2 to 4 centimeters below your right rib cage near the middle. The second is directly over the liver tissue. If you're doing nerve-focused stimulation, keep it gentle. Think tens to hundreds of milliwatts for 15 to 20 minutes. For direct liver work, use a low-pulsed setting, around 0.08 to 1.5 watts, 3 to 5 times a week. Move slowly, keep your focus on that area, and imagine you're helping your liver repair itself. Here's how to get the most out of your sessions. Be consistent. Doing this daily or every other day is way better than once in a while. Try doing it before breakfast to help with blood sugar control. Drink plenty of water, maybe with lemon, to support your liver's detox work. And if you want an extra anti-inflammatory boost, you can also do a spleen ultrasound session. Just make sure to space it a few hours apart. Track your progress by keeping an eye on your energy, digestion, and any changes in your lab results like ALT or AST. This is a gentle technique, but you still need to be safe. Avoid using high-intensity machines meant for destroying tissue. That's not what we want here. Work around your ribs so the sound waves don't bounce back. And if you have active liver disease, metal implants, or serious diabetes complications, talk to your doctor before trying this. Done right, it's non-invasive, drug-free, and early studies suggest it's well tolerated. Here's why this method is so exciting. Research shows it can improve energy, reduce bloating, sharpen your focus, and help balance key health markers like blood sugar and liver enzymes. People often ask if they can combine liver and spleen sessions. Yes, just keep them a few hours apart. Why focus on the porta hepatis? It's the nerve control center for your liver. About 90% of your metabolic signals pass through there. Some people even feel emotional after sessions because the liver is tied to stress release. Expect to notice energy or mood changes within 1 to 3 weeks and lab improvements in 2 to 4 weeks. For more written and visual guidance, please visit school.com/Vegas/classroom to see more on the liver as well as other stimulation locations. Thanks, and stimulate responsibly.